Yeah, so I can hit the record. We're recording now. So after the webinar ends, I'll be able to send a follow-up email to all of you with the slides, including the recording for today. So don't worry too much about taking pictures of the slides or scrambling to take down any notes. Just take down what you want to take away or what you want to remember, because you will have access to all of this after the fact. All right, so let's take just a little look at a couple statistics, because I think it's really important to take a look at the research and data that has been coming out and has been made available. This is something that has been continuously changing as, as research continues to be done. It's important to keep our eye on it, so we can kind of navigate, or at least keep an eye on the impact that we have been seeing. I think it's safe to assume that there has overall been a fairly negative impact on really everyone's mental health, especially over the past year and a half. There's been increases in feelings of anxiety, of depression, of psychosis, of substance use, really across the board. And especially for those folks who were already experiencing mental health challenges or experiencing a mental illness, we saw the severity of those symptoms increase as well, during the pandemic or everything else that's been happening in the world as well. Before the pandemic, we had some numbers come out as well. So almost 4% of Hawaii residents live with a serious mental health condition or conditions, and almost 70% of those folks who are experiencing a serious mental illness did not receive any treatment. And I think that's pretty reflective of the type of help-seeking behaviors that we have seen, and indicative of all the barriers that are in place that make it hard for people to be mentally well, right? Or to seek help and to access services and to access resources. There are a lot of different kinds of barriers that are out there. One of the biggest ones being stigma. Unfortunately, there still is a lot of stigma that's associated with mental health. And it really silences the discussion, right? It makes it hard for people to reach out for that help or to look up what those resources or those programs or those services are. So I think the more opportunities we have to educate ourselves, with webinars such as this one or other additional trainings that are out there, or even just everyday conversations that we can have with our friends, with our family, with our loved ones, it helps to normalize the conversation of talking about mental health in general. And the more that we can create those safe spaces to have those conversations, I think the more of a message we can send to people that it's okay to not be okay sometimes, right? But it is okay to reach out for help, because there's a lot of help that's out there. It looks differently for everyone, but there's a lot of really great resources that are out there and people who care as well. So hopefully, as we can continue in that trajectory of continuing these conversations, we can change some of the numbers that we see here on this slide. Pre-pandemic, we saw, or we have seen from the research, that someone every other day dies by suicide here in Hawaii. So suicide prevention efforts here in Hawaii are happening. Right? Mental Health America of Hawaii is involved in many of the suicide prevention efforts that are happening. There are additional trainings that are out there, resources as well. But again, it's important to take a look at these statistics, at these numbers, both before the pandemic happens, during, and even continuously to do so as that research continues to come out. So we are able to adjust our programming, that we are able to highlight different resources or make it easier to access various services that our communities need to promote mental wellness or to address any kind of mental health challenges that may arise. Okay, so here's a chart from the Department of Health and their EMS and Injury Prevention and Control Systems branch. So this shows the top causes of fatal injuries in Hawaii. So across the top, we have the different age groups. On the left-hand side, we have the different rankings. So we can see that suicide is one of the top causes for fatal injuries here in Hawaii, almost really across the board, but especially so for our youth and young adult ages. It's the 10th overall leading cause of death in the nation, right? In the United States, it's the second overall leading cause of death for our youth. And it's the top cause of fatal injury for our youth, specifically here in Hawaii. So anytime I look at statistics like this or graphs like this, especially that have to do or pertain to suicidality it can be alarming, right? It can be certainly very, very concerning to see that suicide is so high up there on these charts. But what we like to do as well is look for those little spots for hope, right? Where are the opportunities that we can step in and help, right? Those opportunities for that prevention to happen. And we know that prevention efforts do work. It's been proven. If we can think about car accidents, so the amount of deaths related to motor vehicle accidents have decreased over the past couple of decades. And that's really because of the amount of prevention efforts that has been put into preventing those deaths, right? We've been creating safer vehicles, establishing various traffic laws, raising awareness about drunk driving or distracted driving. So if we can put that same kind of prevention effort into suicide prevention, then I also really think we could see a change in these numbers as well. And these efforts are happening in Hawaii. If you are interested in learning a little bit more about what those efforts are or want to become more involved, feel free to reach out to us. There are different task forces throughout Hawaii. In each county, there's also a Prevent Suicide Hawaii task force for the entire state. We can help put you in contact with the people who are running each of those groups or the larger task force as well, but just know that those efforts are out there and they are happening. There are certain kind of risk factors that are involved that make it more likely that someone may experience a mental health challenge, right, or start to struggle with their mental health. And risk factors are just that, right? They're not guarantees by any means. Just that if someone is not getting the right amount of support, if they're not connected to the right resources that they might need, then it could increase their risk for it. Okay, so I know kind of initially looking at this graph, it may seem a little chaotic, but there's actually a really easy way to interpret this and to look at it. So this graph provides an overview of what those various kind of risk factors are and also where they can be found. So across the bottom, we see a progression of developmental stages, starting from early childhood and moving on to older adulthood. On the left-hand side, we see different kind of levels of systems that really make up our society, right? So starting at the bottom on a very individual level and moving upwards, broadening out into what makes up different cultures, right? What informs different policies and social norms as well. And then across the top, we can see examples of the different types of settings where these risk factors can be found. So the easiest way to utilize this chart here, this graph, is to draw a line either from the bottom to the top or from the top to the bottom, right? So for example, if we can choose adolescence, let's say, and draw a line up to school, because we know that our youth and young adults have been struggling, right, with their mental health, especially with everything that has been happening in the school setting, right? Having to adjust to virtual learning or distance learning, going to blended models where it's kind of broken up a little bit and having to adjust because they have to go back to distance learning, back to in-person, back and forth, right? So if we can draw that line from adolescence right up to school, then we can see all the different kinds of risk factors that also may be involved, right? So there may be a physical ill health, so there may be some physical aspects that are being impacted, right? Not as much, exercise that is happening or physical health education that is happening. There could be some substance use, right? Mistreatment, conflicts at home or within the family, difficulties at school, of course, that makes sense. Peer pressure, I think that's something that comes along in general when going to school, middle school, high school, elementary school, right? Being around peers and how informative or influencing those opinions of classmates can be. Adverse media influences. So we see all these different kinds of risk factors in these different kinds of settings, right? So that's just an example of how to utilize this graph. We can pick a developmental stage. We can choose a setting as well, really identify those. I think it's just as important as it is for us to identify risk factors, it's just as important for us to identify protective factors as well. And I think that's something that's sometimes missing from the conversation when we talk about mental health and what can we do and how can we help support, is that we're always looking for these risk factors, right? Where can we step in to help intervene, to help mitigate risks? But what we're sometimes missing is where can we step in to help make things stronger, to boost emotional strength, or to increase someone's sense of resilience. And I'm sure that if we had the time, we could probably brainstorm a chart that looks very much like this one, but entirely full of different kinds of protective factors. And actually, research has been showing that by changing just one protective factor, by making one of those things stronger, it's about 3 times more impactful than trying to change just one of these risk factors here. So we do want to be spending more time and energy trying to bolster protective factors, right? Increasing people's emotional strength, boosting their sense of resilience. Right, so when we're talking about mental health, when we're talking about, you know, the importance of practicing self-care, sometimes we also like to identify who should be practicing self-care. And then along the lines of those conversations that are happening, you may encounter people who say like, I'm okay, I don't need self-care, right? Everyone needs self-care. Even when you feel like you don't need self-care, you should still be practicing self-care so you can continue on that trajectory of feeling okay and feeling good and feeling fine. No matter where you are on the mental health spectrum, taking care of ourselves, right? Taking care of our mental health and making that time to practice self-care is super important. However, there are certain vulnerable populations that would definitely benefit from extra support, right? Extra opportunities to practice that self-care and identify different coping skills as well. So individuals who are at high risk or who have contracted COVID-19, any individuals with pre-existing medical, psychiatric or substance use challenges, our frontline workers, right? Essential workers, healthcare providers, nurses, doctors, different age groups as well. So younger children, adolescents, teens, older adults as well. And then the people who are taking care of those age groups too, right? Different caregivers. People who have lost their jobs, right? Or changes in their employment status, people who are socially isolated. So I know we all have been kind of isolated in a sense, in a social sense, especially over the past year and a half, but especially those who are having a hard time connecting, right? With their friends, with their loved ones, with the larger community as well, is definitely considered a vulnerable population. We want to make sure we're keeping our eye on vulnerables in our social circles as well. Any kind of marginalized groups and individuals experiencing houselessness as well. So a lot of different kind of minority groups or marginalized populations, vulnerable populations that we want to keep our eye on. We want to be checking in and making sure that they are connected to the support and the resources that they also need to help them get through the time that we've been trying to get through altogether. Okay, so as we start to experience increasing levels of stress and anxiety, it starts to present itself in different ways. So we can kind of define these categories as psychological symptoms, so the things that are maybe happening with our behaviors, our thoughts, our emotions, and then our physiological symptoms, right? The things that are happening with our body when we can start to feel it in our body, is those physiological symptoms. So historically, people have really thought of physical health and mental health as being two separate things, but actually they're very much connected. And we can see that connection here, right? When we take care of our physical health, we're also taking care of our mental health. When we take care of our mental health, we're also taking care of our physical health, right? So psychological, like I said, is everything that's kind of happening on the inside. So within our minds, our thoughts, our emotions. So it could present itself as excessive worry or racing thoughts. You can't stop thinking about the things that stress you out, that give you anxiety, that scare you or worry you. It could be more outward expressions of irritation, right? And frustration and anger as well. It could be feelings of restlessness, having a hard time concentrating or paying attention. So not just kind of showing up to those vast amount of Zoom meetings that we have, but actually paying attention and participating. Any changes in our patterns and behaviors. So things like having sleep problems, right? Any changes in our sleep patterns can, of course, have a large impact on our mental health. So we want to be on the lookout for any of these signs or symptoms on a psychological level, but also on a physiological level. This is when we can start to feel it in our body, right? So an increased heartbeat, a shortness of breath, chest pains, any kind of muscle tension that's happening, maybe a little sense of dizziness or nausea or stomach pain. So let me ask you, since historically people thought of physical health and mental health as being separate, if we just looked at the right-hand side, the physiological symptoms, if someone came to you and they said, my heartbeat is super fast, it's hard for me to breathe, I'm experiencing chest pains, I'm lightheaded, right? Feels like I'm gonna pass out. What do you think that would be or could be? What would be your first guess? And feel free to drop it into the chat box. If someone started to have the symptoms on the right-hand side, those physiological, what would your first assumption be? Right. Yeah, I see a bunch of answers coming into the chat and they're all the same: heart attack, right? Absolutely. That would be our first, the first thing that our mind would go to, especially if someone who's experiencing chest pain, right? Shortness of breath and rapid heartbeat. That could definitely be an indication of a heart attack. It could be an indication of an allergic attack as well, right? A panic attack. So if we are unsure, and the reason why I asked that question and why I'm bringing it up is because if we are unsure if it is something that's mental health related or something that's physical or medical related, then we always want to take care of the medical side first, right? If we are unsure if it's a panic attack or if it's a heart attack, then we are connecting that person with the medical professionals first, just to make sure that they're taken care of on a physical level before we move on to the mental health things, right? And providing the support, connecting them to the resources that so asking, does this person have a history of heart-related problems? Have they or we checked in with their general practitioner recently? Are they on medications? Again, if we are unsure of any of this, we always want to address the medical before the mental. But sometimes it can be hard to tell, right, between those, or make that distinction between those different physiological symptoms and what they could be indicative of. Right, so you've already heard me mention a couple times, those importance of protective factors and boosting emotional strength and increasing sense of resiliency. So what exactly is that? Right? There's a lot of different pieces that make up someone's sense of resiliency, and we can see them here. Right, so we're going to be talking a lot more in depth about different kinds of self-care practices and different kinds of coping skills that we can utilize as well. But we have to make that focus and carve out the time for it, even if that's just 5 minutes out of your day, a couple times a day. If you can make that for your self-care time, that is you investing in your mental health. That's you boosting your sense of resiliency. So educate ourselves, right? Raise awareness about the different kind of coping skills and self-care activities that we can turn to. And planning ahead helps as well with increasing our sense of resiliency as best as we are able to, right? No one can predict the future. Sometimes planning ahead helps us to feel better prepared for any kind of upcoming challenging situations, or makes us feel a little less anxious about uncertainty. But no one can predict the future. We can only do the best that we can, plan ahead as best as we are able to. Making sure that we're taking care of those basics as well, that we are staying hydrated, that we are eating a healthy, balanced diet, we're getting a good amount of sleep every night, that we are getting a regular amount of physical activity in our lives as well, and taking breaks as needed. Yeah, we live in a world where it's almost a badge of honor to be constantly multitasking and working on something and wanting to be productive, right? Look at all the projects that I'm working on, look at all the things that I'm juggling, and I'm still kind of pushing through, right? Which is great that you are getting things done and feeling productive, but sometimes we have to take a break every once in a while too, and that's okay. We have to give our bodies and our minds a chance to recharge, right? And to take a rest. Otherwise, if we just keep going, then we're only burning ourselves out from the inside. And then over time, eventually, we're not going to be as effective or feel as productive or be able to juggle or multitask as much as we did before. So it is important to carve in those breaks, right? Take those breaks as needed and make sure that you are staying connected. Right? The only way that we have made it to this day is because we have done so together. The only way that we are going to continue moving forward is if we do so together as well. We have to be able to stay connected with our friends, with our family, with our loved ones, and with each other, right? With the larger community as well. We, of course, have to get a little creative with it, make sure we are following safety guidelines, but we are able to still connect in different ways. Luckily enough, we do live in a world today where technology still allows us to be able to connect, such as we are doing right now. But people still can connect. And I've seen people get really creative with this, especially our youth, right? They've had Zoom dance parties, streaming movies and television shows at the same time together, cooking meals together through FaceTime, taking things outside, right? To having a picnic at the park or heading out to the beach. So we have to make sure that we are finding ways to stay connected, because that's a really important part of taking care of our mental health, is connecting with the people that we care about and who in turn care about us as well. And then just remembering that we're all doing the best that we can, right? You are doing your best, and that is good enough. It doesn't matter how big of steps you take. It doesn't matter how many times we might trip or stumble or stray off the path a little bit. As long as we're putting our best foot forward, making our best effort, then that is good enough. And take pride in those little wins, right? Those little accomplishments throughout your day, as small as they may seem. Like, I woke up on time today. I washed my hair. The kids learned something new. Like, we did the dishes today. Like, those are all wins throughout your day. So be proud of those little moments as well. It's going to help boost your sense of resiliency and make you feel like you can keep pushing forward and you can keep going. Right, so a really important part of self-care is practicing that self-love, right? It's investing in ourselves. We are deciding what works for us. And I think that's a really cool thing about practicing self-care, is we get to decide what we like to do and what is effective for us. Again, the key is carving out the time, making it that priority, and making sure that we are filling up our own cups, that we're recharging our own batteries so that we can show up for others, right? Oftentimes we maybe have responsibilities, right? We have people in our life that we have to show up for, be there for, to take care of, and we can't do that unless we make the time to take care of ourselves too, right? You can't pour into others when you yourself are empty. So find that time to refill your own cup, whatever that looks like, feels like, smells like, tastes like, sounds like to you. I was missing a sense there. But whatever that is, right? Find what works for you, but also find what's going to work for you in different situations as well. So you'll notice on some of the images that we have in this presentation, that tag at Live Now, that's actually our self-care Instagram page. So if you are on Instagram, feel free to give us a follow. We like to post different tips on practicing self-care and opportunities to be able to do that and why it's important. There are a lot of different pieces that make up practicing self-care. A really important one is validating our emotions. It's okay to be feeling the way you're feeling, right? It's okay to be experiencing what it is that you're experiencing. We as human beings, we have a whole wide range of different emotions, and we don't necessarily have a whole lot of control over those. Those things just pop up as they pop up. But what we do have some control over, at the very least, is number one, validating them, but also our responses to them. Right? What are we doing to help try to make ourselves feel better when we're starting to feel down or upset? What are we doing to help calm ourselves down when we're feeling overwhelmed or frustrated, right? Or upset and angry in that sense, right? What are we doing to help find that balance again, or to manage those kind of mixing of emotions? With so much that has happened over the past year and a half, not just with the pandemic, but, with the political climate of our country today, with everything that's happening in the world, the social and racial unrest and discrimination that has been happening for a very long time, but we've certainly seen a lot more awareness and light being shown on it, especially over the past year and a half. All of these things on a societal level, on a world level, have been impacting our mental health, making us feel different things. So that's a normal response to a stressful situation. So make sure you are validating your experiences, because they are valid. It's normal for us to be experiencing these. I've already talked a bit about the importance of staying connected, getting creative with it. Make sure you find that time to check in, right, with your friends, your family, with your loved ones, but find the time to check in with yourself too. If you are a more, let's say, introverted person and spending some time alone, right, and you're sitting in your own space, is a way for you to recharge your batteries, then absolutely please feel free to do that. Right? I'm not saying that you have to be super popular and have a huge giant group of friends. As long as you have a couple meaningful ones, right, and know that people are out there who care about you, then that is great. But we want to make that effort to be able to stay connected as much as we are able to, and as much as we feel comfortable in doing so. Check in on the vulnerable in our circles. If you have any essential workers, frontline workers, or anyone who are in the vulnerable populations categories, just check in. That check-in doesn't have to be anything huge. It doesn't have to be a huge grand gesture or making like a huge time commitment. It could be something as simple as sending a text message and saying, hey, I was thinking about you today. I hope you're having a good day. Is there anything that you need? Right? I'm going to the store later this week. Is there anything I could pick up for you and just leave off on your porch or come drop off to you? Like, that's really simple, so we can just do that check-in and ask those questions, and it sends a message to the other person that I care about you, right? And I just want to make sure that I can be there to help support you in any way that I'm able to. We want to rely on our creature comforts as well. I don't think I have to explain that one too much. If you have a pet, if you have access to a pet, or at least a pet that you get along with, right, and you enjoy spending time with, then you already know that connecting with our creatures, whether they're furry, scaly, feathery, it's a great way to practice that self-care because it just makes us feel good, right? To be with someone who loves, or because I think pets are people too, just to be around someone who loves us so unconditionally. We want to do our best to follow a routine, right? Follow a schedule. Even if we are learning or working remotely or from a distance, we crave routine, we crave consistency. So continuing to go to bed around the same time every night, wake up around the same time every morning, do our best to set different time points in our day where we can take breaks, where we can schedule in that self-care, get the things that we need to get done, but also transition into relaxing, right? Especially if you have been working remotely, right? You don't leave the office and commute home as that kind of transition into your afternoons and evenings, right? You're all in kind of the same place in the same setting. So it might be a little hard. So if you can find structure and routine and little rituals even for yourself to kind of end your workday, log off, shut down that laptop or that computer, those devices, and transition into your evening, where you can practice that self-care, right? Take that rest. That's going to help us continue moving forward with our days if we have some structure in our lives to be able to help us do that. We want to utilize social media responsibly, right? So this does include sharing and identifying and sharing different kind of online resources. But I will say that if you are sharing different online resources, make sure you're doing your homework, that it's coming from a reputable source, right? From a reliable source, a reputable organization, that you're reading it from beginning to end, so you know that it is reliable and something that can be shared and should be shared. But I think it's great to pass along different kinds of resources, even if it's something that you yourself may not be using. You could post something or share something and someone could be following your feed, right? Or it comes up on their feed and they think, wow, this is exactly what I've been looking for, and I'm so glad I stumbled upon this post, right? And I stumbled upon this resource. So it's absolutely great and a great way to practice self-care by sharing those resources, right? But we also want to use social media responsibly too. It's okay to take breaks every once in a while, to take that step back. I always encourage people to ask themselves, do I feel better after I look at Instagram or Snapchat or Facebook or TikTok? If that answer is no, or I'm not sure, or I actually feel worse after I look at my social media, then it might be a good opportunity to just check in with your social media habits, right? Take a look at who you are following, what you are following, what kind of content you are being exposed to, and how often. It's okay to take a step back, take a break, whether that's for part of the day or a more extended period of time. Social media is one of those things that's not going anywhere anytime soon. It's always going to be there when you choose to step back into it. But utilizing it responsibly is also checking in with ourselves and making sure it's not having too much of a negative impact on our mental health. If we are engaging with other people on social media, using social media to stay connected, which I know has been something that's really big, especially over the past year and a half, reminding ourselves, reminding our youth, reminding other people that even while online, we should remain respectful and compassionate, even when there may be differences of opinions, right? Or things that we may not see eye to eye on. Yeah, even when we're conducting ourselves online, we have to keep that respect, that kindness, that empathy, and that compassion as well. Investing in yourself is really important. That goes along with, I can't say it enough times, I've been repeating it over and over again, right? That investing in our time, or investing our time into practicing that self-care, working it into our schedules, and getting outside, right? Unplugging sometimes, getting outside, breathing in that fresh air. There's something to be said about connecting with your outside physical environment that just does wonders for our mental health. Okay, so now that we've talked about the kind of normal responses to anxiety and stress, right? Those different symptoms, psychological and physiological, that we may experience when it comes to stress and anxiety, let's take a look at when things have started to progress, right? When is it more? When is it beyond that normal response to a stressful situation? And that's when we may start to notice any of these types of warning signs. So if someone's mood has been impacted or dysregulated for 2 weeks or longer, so I'm not a mental health professional, I'm a public health person, so I don't have the ability to diagnose someone or myself with a mental illness or a mental health challenge, and I'm not trying to turn any of you into a mental health professional either. Unless you already are one, then thank you so much. We love you and we need you in this world. But that's not our goal here, right? Our goal is to just educate ourselves a little bit. And that 2-week mark is a really good time frame for that check-in to happen. If we notice that we ourselves haven't been acting like ourselves, or we notice someone in our life hasn't been acting like themselves for 2 weeks or longer, then that's a good opportunity to check in. Anyone who experiences anhedonia, so like a loss of interest, so they start pulling away, right? They're not participating in the same kind of activities that they used to really enjoy doing. It brought them a lot of happiness and joy, satisfaction. They start to pull away, and it's not because they're exploring other interests, right, or other hobbies, which is great, right? We want to be able to explore different things, but they're just starting to pull away from different activities and not replacing them with others. Anyone who expresses any kind of suicidal behaviors, right? Anyone who is having thoughts of suicide, they're talking about, writing about, posting about death, dying, suicide on their social media, in verbal conversations, exhibiting different kind of major changes in behavioral patterns, should be a warning sign for us. We definitely want to make sure that we are keeping an eye on that person, that we are listening with our entire bodies, and that we are connecting them with the help and resources that we need, or that they need, especially if they are having thoughts of suicide. And we will identify what kind of questions we should be asking and identifying those resources specifically in just a couple slides, but it's definitely one of the bigger warning signs that we want to be looking out and listening for. And then the rest can be summarized and put simply as, how much of an impact is this having on someone's life, right? If they are having a hard time getting through their day, so if it's hard to wake up on time in the morning, to show up on time to those Zoom meetings, to eat regular meals, to get a good amount of sleep every night, if it's starting to affect someone's ability to learn new things or be productive, so not just show up to those meetings, but to pay attention, to concentrate, and to contribute, to get projects done, or if it's starting to affect someone's ability to connect with other people, right? If it starts to affect friendships or relationships, then again, it's a really great opportunity for that check-in to happen, to start asking some questions and find out if there's any way that you can help, or if we start to notice any of these things within ourselves, right? Just know that there are a lot of different kinds of resources that are out there. There are people who care and who want to help, so reach out. And if you're not sure where to start reaching out for that help, feel free to reach out to us at Mental Health America of Hawaii. We're always happy to answer any questions that people might have to the best of our ability. We're also happy to help point people in the right direction if they are looking for any kind of specific resources or programs or organizations that are out there. I'm sure our contact will be somewhere on this slideshow, probably towards the end, but I'll also make sure that we drop that information in the chat box too before we sign off together. I think it's really important when we're talking about our mental health, really important stuff in validating our experiences and our emotions is touching on the process of grief, right? We want to keep our focus and our energy towards hope and healing and moving forward. But a part of that is acknowledging the grief that we've all been experiencing. And grief is not just the loss of a person or a loved one, right? The death of a close family member or a close friend. Grief at its core is the loss of something in general, right? It could be a loss of a relationship. It could be the loss of how we've interacted with our coworkers, with our family, the loss of the ability to get together and celebrate milestones and celebrations and holidays in the ways that we used to be able to before, right? Different, a loss of being able to get out and travel and have new experiences, right, in different places. A huge disruption in our lives, our schedules, our routines. So everyone has been experiencing some form of grief, some sort of loss over the past year and a half. And it's important to acknowledge that, right? And allow that space and that time to grieve in your own way. And a big part of that, again, is validating our emotions and our experiences. Again, it's okay to be feeling what you're feeling. It's also important to not cross compare our experiences to others, right? We want to be careful about invalidating our own experiences by saying things like, someone else may have it way worse than I do, right? It's not that bad what is happening with me or what I'm experiencing, because there's plenty of people out there who have it way, way worse. And, when we say things like that or we think along those lines, that's kind of invalidating to our own experiences, right? Pain is pain and we all need support around it. So it's okay to be kind of going through this process, but finding support and help in kind of navigating those emotions, those feelings, and navigating that process as well. Right, so I've talked quite a bit about the importance of checking in. Right, we want to do that check-in with the people that we care about. If we start to notice them struggling with their mental health, we want to do that check-in with ourselves, right? We want to ask ourselves those questions as well. So this is a really great kind of guide to help us in the process of that check-in, the kinds of questions that we want to be asking them and why we want to ask them. So when we want to start to have that conversation, is how am I doing from the day to day, right? Kind of gauging how is my sleep, how is my mood? We're kind of gauging how much of an impact is this having on someone's life? Is it affecting my day to day or their day to day? Is it affecting any kind of patterns or behaviors like sleeping habits or eating habits? Is it causing mood dysregulation, right? Is someone not acting like themselves, or their emotions are fluctuating pretty significantly for an extended period of time? It may be a good opportunity to reach out for the little extra help and support, right? Thinking about connections as well. How are my relationships, right? How are my connections with my friends, my family, my loved ones, my coworkers? And how am I staying connected? What am I doing to stay connected with the people that I care about? Or am I starting to withdraw? Am I starting to pull away? Or am I noticing that someone's starting to pull away or withdraw? And I know we've been spending a lot more time, or people have been spending a lot more time on social media to stay connected. So we may start to notice these behaviors on social media as well, right? Someone who usually posts a lot, right? They're very active. They're always posting on their stories, always posting different pictures, commenting back and forth, sending messages to each other. And they start to pull away, right? They're not engaging as much. They're not posting as much as they did. It could be an opportunity for us to check in with them, to send a message and say, hey, I noticed you haven't been posting as much as you usually do. Is everything okay? Is there anything going on? Is there anything you'd like to talk about? Hey, again, a great opportunity to check in, but we can gauge that and we can find out if we may want to do that check-in by asking some of these questions here. Right? We can ask questions like, how is work, right? How is school? Are you just not showing up, but are you paying attention? Are you learning new things? Are you feeling productive? Are you feeling effective? able to get projects done, able to meet deadlines. And one of the most important questions on here is, do I feel hopeful? Like, hope is so important for building emotional strength and for increasing our sense of resiliency. It's how we keep moving forward. If someone feels like there is no hope, like there's nothing to look forward to get excited about, or to work towards, or it's hard to see that in the moment or in the place that they are, then that's what leads to that kind of stuck feeling, right? That feeling of being stuck, of not knowing where to turn, or not knowing which way to go from there. So hope is so important. We want to make sure that we find something that gives us hope in our own lives, but also that we find something that gives other people hope as well, especially if they are in that kind of stuck place, right? We want to continue asking questions if we become concerned as we're doing this check-in, right? So based on the answers that we may get from asking some of these questions, and especially if we may be concerned that someone may be having thoughts of suicide, right, or exhibiting suicidal behaviors, then we need to continue asking questions, and those questions have to be direct. Are you thinking of suicide? Have you been having thoughts of killing yourself? You know, it's a common thing we've heard before, that we don't want to ask those direct questions, that we don't want to talk about suicide because we don't want to put ideas in people's heads. And this is not true. Like, by asking direct questions and by talking about suicide, by talking about mental health in safe and supportive ways, you are not putting the thought in someone's head. Right? You are not planting any seeds. If we don't ask, then we don't know. And if we don't know, how are we supposed to help that person? Right? So it is important that we do ask those direct questions if we feel like we need to. And if you feel unprepared in asking a direct question like that, that's okay. There's even resources out there that'll help you even in moments and situations like that. So we'll be again giving you all those numbers and websites. We cover resources at the end of the presentation, but let's continue moving forward and talk about how do we gauge where we are, right? So this is a Likert scale. This is a really great way to check in with ourselves, right? And determine where we are at, right? Those different levels, and then what are the skills and tools that we can use when we are in a certain place, right? So we have a scale ranging from 0 to 100, broken up into 3 different sections. So the first one is 0 to 40. So this is the range that we are in when we feel good, right? We feel pretty okay. We don't really feel any kind of stress or anxiety. It's only when we're moving closer to that 40 mark where we may start to notice that we're maybe feeling a little anxious or feeling a little stressed. We have that kind of limited awareness. So this range is where self-care is especially effective, right? So this is where we want to be making that time to practice that self-care, to invest in ourselves. The next range that we have is 40 to 60. So this is the range where we are definitely aware that we are experiencing anxiety, experiencing the stress. Usually this is where we can start feeling it in our bodies, where those physiological symptoms come into play, right? So we may notice an increased heartbeat. Maybe we're hyperventilating, we're taking, short, shallow breaths, not bringing a whole lot of oxygen into our bodies. Maybe we feel some muscle tension because we've been clenching our jaw for the past 15 minutes and haven't even noticed, right? Some back pain, neck pain, anything that results from that muscle tension. So this range is where we may start to notice that those self-care activities may not be as effective. So we want to make sure that we're identifying different coping skills to help manage our nervous systems, because at this point, that is what's starting to become activated, is our nervous systems. So the last range that we have is 60 to 100. So this is the range that we're going to highlight for the next couple of slides, especially since I think everyone's baseline has been increased, right, or has shifted upwards over the past year and a half. So where many of us may have started at the 0 to 40, and when we experienced increased levels of stress and anxiety, it pushes us into the 40 to 60 range. Because with everything that's been happening in the world and in our lives, some of us may be starting off in the 40 to 60 range. So when we experience additional levels of stress and anxiety, it really pushes us over into that 60 to 100 level, right? When we start to feel overwhelmed, right, with those feelings of anxiety, or really stressed out where we don't know what to do next, right? So we want to highlight a couple of different kind of tools and strategies. There's a lot of different ways to help us manage, right? To ground ourselves again. One of them is practicing mindfulness. So there's a lot of different pieces that make up the practice of mindfulness and being mindful. People who experience anxiety or feel anxious may have a hard time staying in the moment, right? But we want to do our best to stay present focused. Sometimes we are stuck thinking about the past, right? And how things from our past are still affecting us today. Or some of us may be stuck thinking about the future, right? And worrying and trying to plan ahead for things that we don't know, right? How to plan for. So if we're stuck in the past or if we're stuck in the future, then we're spending a lot of energy on things that can't be changed or we don't necessarily have a lot of control over. So staying present focused helps us to devote our time and our energy on the things that we do have control over, right? The things that we can change. What can I do now to help manage my increasing levels of stress and anxiety? Meditation and prayer can go a long way in being mindful as well. There's a lot of really great, apps that you can download, videos you can look up on YouTube, books to read that'll help you explore taking care of your spirit, right? So practicing meditation, exploring prayer, whether that's within an organized religion or outside of an organized religion as well. If more traditional prayers and practices don't necessarily speak to you, that's okay. There are other ways to be able to practice mindfulness as well. Being engaged, connecting with other people is a great way to practice mindfulness too, right? Usually we think of mindfulness, we're kind of sitting with ourselves, right? Being mindful of who we are, what makes us us, and how we are feeling in the moment. But we can also be mindful when we're connecting with other people. When we are connecting, having that check-in, having those conversations, making sure we are accessible, responsive, engaged, right? That we are in the present moment with that other person. Showing them that we're there with them, right? That we're invested in this conversation, and be a good listener. It takes a little bit of effort to be a good listener. It seems like the easiest thing in the world to do, to just sit there and listen to someone, right? But it takes more effort than that to actually listen to someone, right? Utilizing silence, allowing that space for the conversation to happen, asking questions to ensure understanding or to maybe find out some more information if you're unsure. Like, tell me what that means to you, or can you explain a little bit more about what you just said? Being aware of body language as well. So I might have mentioned earlier that we should be listening with our entire bodies, right? So we listen with our ears. We're listening to things that people are saying, oh, they're not saying. Read in between the lines a little bit. We're listening with our eyes. So being on the lookout for changes in people's behaviors or patterns. And we're listening with our hearts and with our stomachs too. I know it's not a very scientific thing for me to say, but if something that someone says or something that someone does just doesn't quite sit right with you, gives you that bad feeling in your stomach, don't just ignore that feeling, right? Ask more questions, find out some more information, because that instinct could be there for a reason. Single tasking versus multitasking is hard to manage sometimes as well. Multitasking means our attention is split even when we feel like we're really good at it. So taking the time to focus on one thing at a time is a really great way to walk that mindfulness path. And then practicing radical acceptance as well, right? And really, if I could provide a short summary on it, it's focusing on the things that we do have control over. If I can change something, then I'll work to change it. If I can't, then I need to accept that it's unchangeable and not something I have control over, and do my best to try to move on from it. When we hold on to thoughts of unfairness or we get stuck on things that we don't have control over, it doesn't help with accepting the reality of the situation, right? That sometimes we have to let go of those things that we don't have any control over, and we want to get out of that stuck place. So it is important to note that acceptance does not have to mean agreement, right? Accepting that something painful has happened and moving forward is not the same thing as saying it's okay that this painful thing happened, but rather that I'm taking the energy and the time from ruminating over it or even denying that it happened, And instead, I'm putting that towards healing from it, right? And moving forward. And this takes practice. This is not something that will just magically happen overnight. It's a daily practice. And sometimes it needs to be done with the help of a mental health professional. And that's definitely okay, right? To reach out for that extra help and support from a mental health professional in this process as well. But we want to identify different coping skills that are going to work for us as well. There are a lot of different ones that are out there. So explore the ones that are going to work for you. We expanded a little bit on the practice of mindfulness, but there's meditation, there's deep breathing exercises. I love deep breathing because it's something that you could do no matter where you are, no matter when you need it, without drawing too much attention to yourself, right? You're just bringing oxygen back into your system, helping to calm down your nervous system, and help ground you, right? Bring you back to the present. There's other relaxation techniques like progressive muscle relaxation, autogenic training, different other grounding exercises, and things like aromatherapy as well. So explore all the different ones that are going to work for you. Again, there's free apps that are out there, videos you can look up on YouTube, and even other trainings that we offer at Mental Health America Hawaii that help you explore a couple of these different coping skills. But it's important that we have some of those on hand, right? That we have them on hand for different situations when we're in different places as well. There are also things called distress tolerance skills. So when we get pushed into that kind of 60 to 100 range and we start to feel really overwhelmed, these are the skills that are going to really quickly and effectively calm down our bodies, right? And put us in a place where we can continue different coping skills or self-care activities to help continue calming ourselves down or to start to make ourselves feel better. One of our favorite ones is the dive response, right? So we have a gland inside of our nose area that stops us from involuntarily breathing whenever we go underwater, right? Even when we're unexpectedly submerged. If someone pushes us into the pool or into the water, our body automatically holds our breath, right? It recognizes that we're not in a place right now to bring in more oxygen. So I have to try to conserve as much as I can. So as a result of that, our blood circulation slows down, our blood pressure slows down, our heart rate slows down as well. And so it's a really quick and effective way to just calm down our bodies, especially when we really start to feel overwhelmed. So a really easy way to activate the dive response is to get a cold, wet rag and just lay it over this portion of your face, or get a bowl of cold water and just dunk your face in it. Right? Hold your breath for about 10 seconds. Both of those things will activate that dive response, so you don't actually have to jump into the ocean or jump into a pool. You can activate that dive response and really immediately it's just going to calm your body down. And then you can move on to those other different kind of coping skills or self-care activities to continue to try to make yourselves feel better. And I know I'm coming up on the end of today's time together. And I do want to make sure I leave time for questions, but just really quickly before we get to that, know what your support plan is. Support plans aren't just for people who are in a crisis, right, or experiencing mental health challenges. Every single one of us should have a support plan. So who are those people that we can turn to, right, when we need someone to talk to? If we have any kind of providers, we have their contact information on hand. What are those crisis resources? Have those programmed into our phones, and ask ourselves those bigger questions, like what gives us hope? What gives our lives meaning? What helps make up me, right? What helps make me feel better when I'm in different places? So here are a bunch of different examples of the different kinds of crisis lines that are out there. Again, I'll send all of these in the slides over to you, as well as a resource handout sheet. We have the National Suicide Prevention Lifeline, the Hawaii Cares Line, which are both available 24/7. We have different resources that are available. Since we've all been spending a lot more time at home, we know that not every home is a safe space, so we want to make sure we're aware of these resources as well. Reporting child abuse, right, or unsafe environments for our keiki, trafficking, and for our kapuna as well, right? So if we have someone who is experiencing intimate partner violence, domestic violence, we have these resources. Again, there's a lot of free apps that are out there as well. These are just a couple of the ones that we often like to recommend at Mental Health America of Hawaii. They're ones that at least one of us has tried out, right, and tested or use in our everyday lives. So find the ones that work for you, that you enjoy using as well. You can check out our website, or reach out to us if you have any questions about anything, but I will open it up to now the few minutes that we have left to any questions. I already see one in the Q&A box, so feel free to use the Q&A box or the chat box if you have any questions. But if those questions pop up later, here's our contact information. I'll also drop my email in the chat, but I do see one question says, will there be another Zoom regarding this topic? I would probably yes. We often offer several different kinds of trainings and presentations like this that are really focused on mental wellness, the importance of practicing self-care. So when I send you the recording for today's training, it'll probably be via our YouTube channel. So if you head over to our YouTube channel, we actually have previous recordings of additional trainings that are really focused on, you know, self-care, coping skills, practicing mental wellness. But I'm sure that we will also be offering various trainings too on this topic. So sign up for our newsletter, continue or keep checking our website where we make those announcements, where we will have our next free and open training for the community, but you can also watch those recordings on our YouTube page as well. I see a question in the chat too. If you don't have medical insurance, where could you seek mental therapy, right? I think that's a really great question because not everyone has insurance, right? Or maybe their insurance coverage it doesn't cover what they need or want it to cover. So if you don't have insurance, that's okay. You still can connect to therapy and counseling and supports. I believe you can connect with different kind of community health centers that will help work with you, connect you with mental health professionals, despite your insurance coverage or lack of coverage, right? Or work with you with your income. So if you are looking for that kind of route, right, and insurance may be a barrier because you're absolutely right, it can definitely be costly. You know, having to pay co-payments, right, or pay for medications or pay for services. But there are different programs and organizations that are out there in the community that help work with folks who may not have insurance, right, who may be where finances and accessing those services may be a barrier. So feel free to reach out. Right? You can send us an email. You can give our office a call. We have a Finding Help phone list as well, which you can access through our website. So if you go to our Finding Help phone list, you can click on that topic of like counseling services, and it will show you all the really great community health centers that are available in your area. But just know that those programs are out there. So again, feel free to reach out to us. We can help connect you with those programs and services that are in your area that you might need. And I already see Jerry helping me out in the chat. For our YouTube channel, it is MHA of Hawaii with that link right there. So feel free to go to that, check out our previous recordings, check out our website. The crisis line is dropped in the chat as well. I'll go ahead and put my email too, but you may already have it because I sent you the Zoom link for today. I know that we are at the top of the hour, so if we're at the top of the hour, so thank you for joining us for today. I hope you found the information helpful and relevant, that you learned new things, or it helped to at least inspire you to make that time to take care of your mental health. I'll stick around for another couple of minutes just in case there are any other questions, but I want to be respectful of your time as well. If you have to jet out, thank you for joining us for your lunch hour. I hope you have a great rest of your day, a great rest of your week, and that you make the time for yourselves and take care of yourselves. Thank you so much, everyone. Again, if you have questions, I'll stick around for another minute or so. Feel free to go ahead and drop them in the chat there.